Welcome to our presentation on aging in place. Today we will be covering the phases of the design thinking process: empathize, define, ideate, prototype, test, as well as observations and lessons learned, and implementation. The first step in the design thinking process is to create an empathy map. We need to observe, engage, and immerse ourselves to better understand our client. We need to know how they think and feel, hear, what they say and do, how they see, what pains they experience, and what they hope to gain. Moving on to the define phase, it is important that we find a good point of view that provides focus and really frames the problem. Our final POV is a religious family man who has worked his way to retirement, who needs to ensure his independence and priorities because he does not want to become a burden to his family. And our most important question is, how might we help them retain
their independence while not becoming a burden?
Our composite character profile is 75-year-old Skip, the husband, father, and retiree. He is very active and enjoys spending time on the golf course with friends and family. He has spent the last 35 years in his home with his wife, and they plan to spend retirement together. His independence is very important to him, and he does not want to burden his children. He is realistic and open to assisted living if his health declines to a certain degree. He loves animals, traveling, and spending time with his children. He is a true family man and fills every room with positive energy. Moving on to the ideate phase of the design thinking process. Here we show our reflections as a group. We spent 30 to 40 minutes discussing our brainstorms after writing as many ideas as we could down. Throughout the design process, our team tried to uncover unexpected areas of exploration, create fluency and flexibility. The urge to not, quote, sell the product was strong, and it was important to sit back and allow the user to experience the prototype and ask questions. Using open-ended questions, conversations developed into overall discussions on the, quote, age-in-place experience and how it has changed over the years. It seems that with digital prototypes, it is hard to get a good gauge on usability without an actual digital product to showcase. Some key questions that really framed our process were: what is the primary need of the senior that we need to address? How can we connect them to family?
Our prototype. The preliminary solution for our prototype is a web-based portal that can serve as a tool for seniors to communicate with their community and family members. The portal would also serve as a resource hub to aid in an independent aging in place process. Keeping our character profile in mind, we wanted the main goal of our solution to focus on the ability to maintain the desired independent lifestyle for our persona. Our prototype strives to achieve this goal, but touching back to our how might we statement, it narrowed our solution to focus on aiding and maintaining an independent lifestyle for our character profile group, develop a tool that would create a positive and safe alternative for assisted living while maintaining an open-ended communication with family members and caregivers, and provide a solution that would provide a peace of mind and security for a long-term independent living environment. During the exploration phase of our prototype development, we wanted the solution to be a user-friendly app where our persona would have the ability to communicate important health, financial, and home maintenance updates in real time. We wanted the solution to be also easily accessible and senior user-friendly. In our initial design phase, we discussed several feature options that included the ability to update and request home maintenance, a place to upload and update legal file documents such as power of attorneys, wills, and post-care requests, as well as the ability to link financial and banking information. The final prototype we developed for testing, we narrowed down the solution to a web-based design versus an app-based design to assist with senior accessibility. The features in the portal included a financial information hub where we would include banking information as well as billing statements for the senior's household, healthcare updates and information for doctor's appointments and medications, daily tasks and alerts for cleaning, grocery shopping, and lawn care needs, and emergency contact information for immediate family members and care providers, as well as an additional note option to promote flexibility and personalization within the solution.
We are given the task of determining the next steps after receiving the feedback. Our testing involved presenting the prototype with the participants. We very carefully showed them how the screens are intended to work without bolstering or attempting to sell the prototype in any way. We then asked the participants if there were any preliminary feedback by their first observations. Then, we asked 11 different follow-up questions, such as, do you see yourself using this prototype in your everyday routine? What resources are most important to you? Do you feel comfortable using a smartphone or app? What support would you need using this application? After each interview, we asked the participant what their overall view of our prototype was. Once this feedback was received,
It's hard to know what to expect without having gone through the design thinking process before. However, after doing the weekly readings, and especially after the discover phase, our group began to formulate certain expectations for this process. We started off with a solid foundation on the general age and place issue. We built on these discoveries by formulating who we expected to serve by addressing this problem and creating a composite character profile. This profile drew largely from our own family and experiences with seniors in our lives. In sum, we expected to come out of the define phase with a strong profile of who we wanted and who we needed to serve. This was our strongest expectation through the first process. The surprises were aplenty. Even though we expected to develop a strong composite character profile, our interviews tended to draw out similar characters, our fathers. Because of this, our character profiles were fairly uniform. This was not an expected outcome. We originally thought that we would have likely 5 unique character profiles from which we can develop our composite character profile. But surprisingly, most of our experiences with our fathers during the interview process drew out very similar concerns about the age and place process. In the evaluate phase, we originally thought that our biggest issue in our prototype was going to be the senior's apprehension to use technology, meaning somebody who doesn't have a lot of experience using apps or web-based applications is going to be uncomfortable using a new application to help them with the age in place process. That wasn't the case. Instead, one of the major critiques of our prototype was the lack of any meaningful security features, seemingly a very millennial or Gen Z concern, not a concern with the usability of the program. One thing became immediately clear to us about the design thinking process. Iteration is the key to success. And I think it goes without saying that if we had more time, we'd have liked to have gone back and made more little bets that would have likely calculated to draw out more information on our prototype and the composite character profile that we drafted. As discussed in the previous slide, finding a more diverse group of interviewees for our character profiles would have likely aided in later phases of the process. And these types of little bets, meaning looking into finding a more diverse group to interview, would have done wonders for our process. Nonetheless, we made several small tweaks and changes to our composite character profile, as well as our point of view statement. As I'm sure is common amongst all of the groups, we made a fair amount of tweaks to our prototype upon further reflection, including adding more features and screens to give the user a better picture of our overall concept and to gain better feedback on how we can improve on our prototype. Now, the old saying goes, hindsight is 20/20, and this situation is certainly no different. Key lessons learned in hindsight are, number 1, not to rush. It is really easy to start thinking about a prototype early on in the process. We learned that you have to do everything you can to push that urge to prototype early out of your head. If you don't, you will really pigeonhole yourself, your ideas, and your overall team. Now, one obvious challenge I suspect all other groups had was doing a project like this remotely. We found that this task would really have lent itself to in-person meetings, which would have created a more robust ideation process. However, on a positive note, we truly believe that this process has helped us not only understand the age and place problem, but it taught us a new formulaic approach to problem solving.